Hi everyone, welcome back. Today we will have a look at the bony features of the bones of the forearm, that is the radius and the ulna. So the radius and the ulna are these two bones and they constitute the bony skeleton of the forearm. This one on the lateral side is the radius and the one on the medial side is the ulna bone. So first we discuss the radius and then we will come to the ulna. So the radius is this typical long bone and it has the following bony features: the head, the neck, the radial tuberosity, the body or shaft, the interosseous border, the ulnar notch, the styloid process, and the carpal articular surface. So this expanded round proximal end of the radius is the head of the radius. The proximal surface of the head has this shallow concavity. This concavity is for articulation with the capitulum of the humerus as shown. The peripheral side of the head articulates with the radial notch of the ulna. The head of the radius is held in place against the ulna by this encircling ligament known as the annular ligament. This constricted area immediately distal to the head is the neck of the radius. And just distal to the neck on the anteromedial proximal aspect of the radius is this raised roughened area known as the radial tuberosity. This tuberosity serves as the insertion site for the biceps brachii muscle as shown. The body or shaft of the radius is this elongated mid portion. The medial border of the shaft forms this sharp crest known as the interosseous border. The interosseous border serves as the attachment area for the interosseous membrane that binds together the radius and the ulna. This shallow depression on the distal medial aspect of the radius is the ulnar notch. The ulnar notch is the articular surface for the head of the ulna, as you can see. This distal projection from the lateral distal aspect of the radius is known as the styloid process. The distal surface of the radius constitute the carpal articular surface. This area articulates with the scaphoid bone laterally and with the lunate bone medially, as you can see in the model. Now we are done with the radius, so let's discuss the ulna. So the ulna is this typical long bone on the medial side of the forearm, and it has the following bony features: the olecranon, the coronoid process, the trochlear notch, the radial notch, the ulnar tuberosity, the body or shaft of the ulna, the interosseous border, the head, and the styloid process. So, this easily palpable proximal end of the ulna is the olecranon of the ulna. The olecranon is the insertion site of the triceps brachii muscle. The beak-like tip of the olecranon fits into the olecranon fossa of the humerus when the elbow is extended, as you can see in the model. This anterior projection forming the inferior end of this hook-like proximal end of the ulna is the coronoid process. It contributes to the formation of this notch known as the trochlear notch, which is a large crescent-shaped notch on the anterior aspect of the proximal end of the ulna. The trochlear notch articulates with the trochlea of the humerus, as you can see. Immediately distal to the trochlear notch, on the lateral aspect of the coronoid process, is this shallow, smooth notch known as the radial notch. It serves as the articular surface for the head of the radius, as you can see. This anterior, distal, roughened aspect of the coronoid process is the ulnar tuberosity. The ulnar tuberosity serves as the insertion area for the brachialis muscle. Now the body or shaft of the ulna is this elongated mid portion of the ulna. The lateral border of the shaft forms this sharp crest known as the interosseous border, which is for the attachment of the interosseous membrane, as we pointed out earlier. This small, rounded distal end of the ulna is the head of the ulna. The head has this articular surface on its lateral side. This articular surface is for contact with the ulnar notch of the radius. However, the distal end of the head of the ulna is excluded from the wrist joint, as you can see. There is this small projection from the posteromedial distal end of the ulna known as the styloid process. Lastly, we are going to have a look at the proximal and distal joints of the radius and the ulna. So, proximally, the radius articulates with the capitulum of the humerus, while the ulna articulates with the trochlea of the humerus. And these two bones, that is the radius and the ulna, also articulate with each other through the head of the radius and the radial notch of the ulna. Now distally, These two bones articulate with each other through the head of the ulna and the ulnar notch of the radius. Also, the radius articulates with the scaphoid and lunate bones, while the ulna does not participate in the wrist joint, as you can see. So this was about the bones of the forearm, that is the radius and the ulna, and in the next tutorial we will be discussing the bones of the hand. So stay with us. Thank you so much.